Hi, my name is Mary. I'm with physical therapy.
Hi, I'm Amber. I'm with occupational therapy. And we are just here to do a little video for you guys about how to put the abdominal binders on the C-section moms. We know y'all are doing a great job, and the binders are usually put on in labor and delivery after they give birth. By the time they come over to mom baby where we see them, they've probably taken the binder off many times since then. And they're not always getting put back on correctly. And so we didn't know if this video would just be a little helpful for you guys for placement and fit. And then that way you can kind of talk through the application when you're putting it on your patient, so then the patient is more aware of how to reapply it once they take it off, so it's fitting them correctly. All right, so let's do a little demo here for you. Mary's a great little postpartum mom for us here. So we're gonna pretend this is the C-section incision here. So typically I always put it on when they are laying down in the bed. This binder in itself does not have very much fabric, and it's really difficult to put on when they're sitting up or standing. So even if they've taken it off, I always ask them to get back into the bed so it can actually fit well. So once they're in the bed, I kind of just roll it up, ask them to bridge. I slide it up underneath them here. Okay, you can relax. Kind of measure, so I went too far, so I kind of pull a little bit. Yep, relax. And kind of just lay right across their belly here. Low abdomen in the incision, wants to be inside. And then once that looks good, I'll just usually ask mom to hold the top of the binder so it stays in place, and I just walk to the other side of the bed. And then from here, the best way I figured that it's fitting is to pull out tension coming towards you. It's really painful for the moms when you're just trying to pull tight and go across this way. So I always try to pull out and teach like the spouse or partner to pull out first before they lay across, and then we can come across like this. Then from here, I ask mom, are you able to take a deep breath? Make sure your ribs can expand fully. If she cannot take a deep breath, it's too tight. But if she says it feels good, she's breathing fine, we'll leave it there. Of course, this is not as realistic as it will be on our moms, but making sure there's no gapping at the top. If there's gapping, it's too loose and have to reset. But this is essentially how we make sure it fits.
Yeah. And just a few more points, just to take into consideration. With the abdominal binder, once you take this and wrap it, and once you pass the gray line, it's not going to really stick to it. So it's going to end up just coming apart. So we just want to make sure that when we stick it on, it's on the gray. We also want to make sure that there is some tension on the binder, because it's going to be providing more support for them. If there's no tension on the abdominal binder, it's not going to do much. So, but I think that's about it. Anything?
The only thing I was going to say also that I just kind of wanted to talk about is this is the medium large size of the binder.
Okay.
The medium large is going to fit 99.5% of the moms. We have the extra large, which does seem in theory that it's going to fit most, but honestly it does not. It's way too big. Most moms that have this on, it's falling off of them. They have to fold it and roll it. It's not providing any support that it needs to. So if we can, I would always try to do the medium large and do it laying down, and then make sure it can fit. And then this would be, extra large would be a last resort. And then if that's the case, I might come and trim it or something like that, just so it's fitting appropriately, because this is just way too big for almost everyone.
Yep. I guess that's about it.
Thanks so much.
Thanks.